All right, there we go. Welcome back. Thank you for staying with us this far. We always have conversations back here on studio, all in line with these discussions that we are about to have. But we welcome you to continue sharing with us. Use the hashtag Good Morning Kenya on Twitter. Our official station handle ever remains to be at KBC Channel 1. My handle is at Jain Wambui. So we want to continue with the viewpoint today. This is viewpoint part 2, and we want to talk a bit about universal health coverage. It is part of the Big Four agenda, and it is something that is expected to be in full capacity and operating by 2030. And looking at the vehicles that have been mandated with this responsibility, at the forefront is NHIF. So how will they ensure that they fulfill their responsibility as the vehicle towards achieving 100% coverage in Kenya and 100% UHC being rolled out in our country by 2030. With us in studio this morning to help us better understand this, we have Gilbert Osoro, who is the manager in charge of UHC under NHIF. Good morning, sir.
Thank you, Jain.
Thank you for making time to be with us today. We appreciate the time.
We greatly appreciate, and on behalf of the Board of Management of NHIF, and to take this opportunity to register our appreciation for this opportunity we've accorded NHIF and invite Kenyans to this conversation.
Absolutely. And that is why we are starting it right here on Good Morning Kenya. So let us even just start with understanding the mandate of NHIF and consequently the UHC department that you run.
Thank you, Jain. As you are all aware, NHIF is a state parastatal. But I will want to take Kenyans on a journey back on the foundations of NHIF.
Yes.
NHIF was started way back in 1966 when the then Parliament passed what was known as Cap 255 laws of Kenya to establish NHIF to provide healthcare services to then government employees and people in the employment sector. But in 1972, there was an amendment to that particular act which opened membership to members of the informal sector.
Yes.
And when we talk of members of the informal sector, we are talking of people who are self-employed. We are talking of mama mboga, juakali artisans, we are talking of mechanics and others. Ever since the NHIF Act was passed, it has undergone several amendments in line with the population increase, changing healthcare dynamics and the economy. And in 1998, there was a major amendment that was passed by Parliament then that repealed Cap 255 laws of Kenya to transform NHIF from a department in the Ministry of Health to a state parastatal, a semi-autonomous body. And what came into being was the NHIF Act number 9 of 1998, which we still administer today. I know many Kenyans are aware that NHIF is being transformed to reposition it as the vehicle through which the government intends to attain UHC. I will later on share the NHIF Amendment Act 2021 that is before the Senate committee awaiting ratification.
Okay.
But having said that, NHIF is the vision of NHIF is to be a social health insurer, and the vision is to contribute towards universal health coverage by provision of affordable, accessible, sustainable, quality health care that does not expose our members to what we call catastrophic healthcare expenditure or financial hardship through strategic risk pooling and healthcare purchasing of healthcare services in collaboration with the stakeholders.
All right. Now that brings us to the uptake of NHIF in our country. For so many years, those that are employed in formal employment, they're required to have NHIF. But looking at the larger part of the population, almost 80% are in the informal sector. And when it comes to actually health insurance coverage, about 15% actually can afford private insurance coverage, leaving the biggest chunk out when it comes to healthcare coverage. As NHIF, how has the uptake been over the years, and particularly looking at the informal sector?
I want to salute Kenyans. It's true what you've said, that insurance uptake is limited in this country to less than 20% of the population. But what you realize is that even the little that have subscribed to any form of healthcare insurance, NHIF has the giant share. As we speak, our membership of principal members stands at around about 13 million. And if we are to put the cumulative figure of the principal members, undeclared dependents, it's 22 million. It is true that majority of the members of the informal sector, the Juakali artisans, mechanics, and others, due to the decline in the economy, some have experienced challenges in remitting their monthly premiums. Remember, our premiums are so affordable. When we call affordable, we are looking at Kenyans remitting only 17 shillings a day for a family-based cover that caters for the principal member, declared spouse, and children arising from that marriage. Ours is not restricted. Yes, there's been a decline in recruitment of members of the informal sector, but the good news, despite the pandemic, we can see a steady increase. And to salute Kenyans for the resilient spirit. Many Kenyans realize the importance of having a healthcare cover. And towards that end, we have rolled out an elaborate campaign to synthesize and recruit members to join NHIF.
Okay. Because earlier on in the year, looking at the NHIF amendment bill that required every member, in order to benefit from UHC, you needed to be a member of NHIF and contribute, because it received a lot of backlash from people saying, you know, making everyone, and especially even the poor households, having to pay these premiums is it's not quote-unquote fair for every individual. Since then, has that uproar gone down in terms of helping even the people understand why it is vital?
Let me say this, that the scripture tells us that my people perish because of lack of sufficient knowledge, in the book of Hosea 4 verses 6. Now, there was a bit of I want to call it interrogation of the bill. And it is entitlement for Kenyans to interrogate whatever bills that are brought to the House.
Public participation.
Yeah, and again, we had erroneous information that got out there that the bill was going to claw back on the gains made in the healthcare system. I want to assure that there are so many benefits that will accrue from the NHIF Amendment Bill 2021 that will go towards cushioning Kenyans from the catastrophic healthcare expenditure that we are currently witnessing. For your information, Jain, 1 million Kenyans relapse to poverty because of out-of-pocket catastrophic expenditure. When I look at my phone, I get an average of 5 to 6 invitation to WhatsApp groups whereby members are raising funds to offset medical bills. With the introduction of UHC, some of these issues will be a thing of the past. I will go straight to the NHIF Amendment Bill 2021.
Yes.
And what you've raised is in relation to Section 15 of the former NHIF Act number 9 of 1998, which has been repealed to make it mandatory for all Kenyans to be contributors to NHIF. And what the provisions of the bill expressly state is that those in formal employment should contribute to NHIF. Those in the informal sector who have an income will be obligated also to contribute. But we have the cohort of people who live below the poverty line, what we call indigents, the poor and the vulnerable, people with severe disabilities. These ones will be subsidized or paid for by the government. So it is a gain-gain scenario whereby when you talk of UHC, and UHC, according to the World Health Organization, is defined that UHC is ensuring all people have access to the much-needed healthcare services that are preventive, promotive, rehabilitative, and curative, that are of quality and sustainable without exposure to financial hardships. If we want to journey towards 100% UHC, we must ensure the entire population of this country as a health cover.
All right. Now, as NHIF, you have been mandated, under the Ministry of Health to be the vehicle towards achieving universal health coverage. But when we talk about UHC, what are the main pillars that come into play?
Thank you. Very important. When you talk of UHC, we have what we call the UHC cube. The first part of the cube, it's a 3D cube, is the population. Which population is covered? Under UHC, we are talking of extension of services to the non-covered population. As you are aware, His Excellency the President and the Council of Governors, during the UHC scale-up, when they had what we call the Intergovernmental Participatory Meeting in Mombasa, that is 31st October last year, decided to upscale UHC by onboarding 1 million indigent family households to the UHC cover that is administered by NHIF.
Yes.
Now, when you talk about the upscale, and we are looking at the Kenya National Population Census, Housing and Population Census, that was done by the Kenya Bureau of Statistics, the average household of a Kenyan is 4 persons. So we are looking at a potential population of 4 million Kenyans, new Kenyans having access for the first time to healthcare services. The other thing when we talk about UHC is the scope of cover. What services are covered? Currently, as we speak, under the Super Cover Benefit Package, which is the flagship of NHIF, we have 10 benefit packages, including the inpatient, outpatient, renal dialysis. We have kidney transplantation in collaboration with the Moi Teaching and Referral Hospital and Kenyatta National Hospital. We have the oncology package. We also
cancer
have
treatment.
For cancer treatment, and it's one of the packages that is highly patronized. As you are aware, cancer now has become a serious problem in this country.
Yes.
We also have the surgical benefit package. We also have diagnostic imaging, where we are talking of magnetic resonance imaging, computed tomography, CT scan, ultrasound, and others. We also have emergency rescue services, and I know, Jain, you are not aware of the emergency rescue services that is administered by NHIF. I want to tell members of the public that in the unfortunate event you are involved in a road traffic mishap, NHIF will be able to, first of all, ensure you get first aid at the location of the accident. You get transport to the nearest empaneled healthcare facility. And for that matter, we have 7,666 healthcare providers that are empaneled and contracted by NHIF, including government facilities, which constitute 75%, private hospitals, and faith-based organizations. We also have the drug and substance abuse package. Jane, you will remember that since the onset of COVID-19, we've had a problem of mental health. I was just reading yesterday, and I saw somewhere in Kabete, a policeman decided to kill his spouse and others. Every week when you check the newspapers, we have cases of people ailing from mental health. The good news is that NHIF caters for drug and substance abuse, inclusive of mental health. We have overseas treatment and others. Now, to come back to the point that you raised, when we talk of scope of cover, under the UHC benefit package, it is a requirement you extend services to the non-covered services. And as we transition to UHC, the advanced plans to include preventive and promotive healthcare. We want to arrest disease before it occurs. It's unfortunate that in the current scenario, many a times insurance providers intervene at the point of ailment, treatment, when you seek treatment at the nearest facility. We want to have a paradigm shift that we encourage Kenyans to lead healthy lifestyles so that they do not fall sick. Towards that, in future, we will cater for what we call mammography, which is one of the tests for breast cancer. We intend to cater for other chronic diseases that are not covered, and others. The third bit, when you talk of UHC, we are looking at catastrophic expenditure. Many people are unable to meet healthcare costs in this country. I'm sure if I were to ask you how many groups that you are contributing, there will definitely be many. To cushion Kenyans, the government and like-minded donors have stepped in to sponsor the indigent population that cannot pay.
Okay.
And the first phase is the government sponsoring 1 million indigents in the scale-up. In this current financial year, if you keenly looked at the budget, the program was scaled up to cover an additional 500,000 Kenyans to make it 1.5 million Kenyans who will be on the government UHC program.
And what's the progress on that so far?
A lot has been achieved because as we speak, we are currently registering the identified indigents biometrically. Allow me to digress a bit. In 2018, the then Cabinet Secretary for Health, Honorable Cicely Kariuki, appointed a task force to transform and reposition NHIF as the vehicle through which the government will attain UHC. The task force was known as the Health Financing Report Expert Panel that was led by Andrew Wambui. We had Professor Gilbert Kokwaro, Professor Edwin Baraza, and others in that particular task force. Now, the task force noted that there were gaps when it came to identification of the members of NHIF.
Okay.
Remember, before the current regime, we used to have what we call NHIF smart cards, whereby at the point of seeking services, you were to produce a copy of your national ID, NHIF smart card. In event you are married, you are declared spouse, they could ask you for a copy of the ID or marriage certificate. And in case of children, a copy of the birth certificate or a notification for children under the age of 6 months. Now, what the task force recommended was a digital transformation, digitalization of NHIF services. And among the services that has been digitalized is identification, whereby we have moved away from the manual systems of producing documents to use of biometrics, thumbprints. And in line with the biometric registration, which is ongoing, which was launched by the President on 31st of October 2020 in Mombasa, when they launched the upscaling program for the 1 million indigents,
yes,
all Kenyans are supposed to register biometrically. And the beauty with biometrics, it comes around with added value addition. You do not need to carry those documents that I've mentioned when you need to access services. You just walk to the nearest NHIF healthcare provider, submit your thumbprint, and you'll be able to access our services. Now, the second bit that is ongoing currently at NHIF, we have the electronic claims records, popularly known as the eClaim. The Health Financing Report Expert Panel recommended that we were losing funds through fraud, wastage, and abuse. And in order to check this fraud, wastage, and abuse, they recommended the introduction of the electronic claims records, which are foolproof. One, they are not prone to errors. You can be able to detect disease trends and patterns, and even be able to flag down instances of fraud. And towards that end, last year on 11th July 2020, there was the big switch in NHIF whereby all healthcare providers between the KEF level 4 to 6, were migrated to the eClaim platform. As we speak, 1,980 facilities are currently on the eClaim platform.
Okay.
Now, as we reposition towards UHC, you'll allow me, I know we are constrained of time.
No, actually, that's why I wanted us to go in line with the reforms that NHIF needs or needed to undergo and still needs to undergo to ensure that you are in full capacity when it comes to operating as the vehicle for UHC.
I will outline them if time allows.
Go ahead.
The other thing that we've done, we realized that the customer is the king and is always right, Jain.
Customer is king.
Our members said that accessing NHIF services was a tall order. And towards that, we introduce self-care platforms. You can be able to access NHIF services from the comfort of your phone or your office. Now, NHIF has introduced a number of self-care platforms. The first one being the USSD platform, whereby you can dial *155 hash. Through that particular platform, you can be able to register for the very first time from the comfort of your phone. You can also be able to choose or change your facility of choice. Remember, at NHIF, we have 10 benefit packages, and one of the benefit packages that requires members to select facilities of choice is known as the outpatient benefit package, whereby the principal member is under obligation to select a preferred facility of choice, whereby they can be accessing the outpatient benefit package. And the provider payment mechanism is known as capitation. So the principal member will select a facility of choice for himself, declared dependents, that is the wife and children. Secondly, we have the other self-care platform, which is available in Android phones. If you go to the Play Store or Apple Store, for those of you who are blessed to own an iPhone, you can be able to download my NHIF app. That particular application is what I call a self-contained platform to interact with NHIF. You can be able to monitor your contribution history. You can be able to check the dependents that are declared in our NHIF database. You can be able to check the status of pending pre-authorization requests that have been launched online. You can be able to see the scope of benefit package that you're entitled to. It also provides for a chat box. You can be able to chat with NHIF customer care experience, a customer care center on real-time basis. So that is another platform that we provide for, that was requested by Kenyans. Thirdly, we have what we call the short query code. You can send a text message to 1550 to make inquiries, for example, of your contribution history. You just type your ID, you type the abbreviations ID, enter the ID number, and send to 1550. It will send you a message indicating your full names, your ID number, contribution status, up to when you've contributed to. I want to encourage Kenyans to make use of these self-care platforms that come with value addition. The other one is the Customer Experience Center. You remember, we've come from an area whereby NHIF used to have a Customer Experience Center whereby people used to make calls. And it was manned by around about 13 staff or so. But in line with the preparation for the launch of UHC, the Customer Experience Center has been revamped, whereby we have about 70 staff who man that center. The center works 24 hours a day, 7 days a week, and 365 days a year. So you can be able to call the Customer Experience Center through the toll-free line 0800 620 701 to be able to make inquiries as pertains to issues related to NHIF. You can also engage our team through the digital platform, whereby you can go to the NHIF website and chat directly to the digital team for them to respond to your queries. Now, still sticking on that part of reform, I know you have so much more to say in regards to that, but we also have a part of the population that have both private insurance and are still, under NHIF. In such cases, how is payment made out to ensure that there's seamless ways of operating, so that if I am the patient, I don't have, there isn't a lot of back and forth with my private insurer as well as NHIF? Thank you for that very important question. I'll go back to the biblical analogies that says, give Caesar what belongs to Caesar, and give God what belongs to God. Now, when it comes to private insurer, there is an erroneous perception that NHIF is the primary insurer of choice. And if you look at the NHIF amendment bill that is currently lying in the Senate, it will make it NHIF to transit from the erroneous perception of being a primary insurer of choice to the secondary insurer of choice. What do I mean by saying that? In future, the private healthcare insurer will pay its bill first. Thereafter, NHIF will be able to meet its part of the bargain. So we are paying, and we are paying promptly for that matter. We don't discriminate members who have other insurances.
Okay.
Yeah.
To also ensure a seamless way working with the public and private areas of the divide. Now, we are short of time, but we cannot conclude before we get to talk a bit about the World UHC Day that is coming up this weekend. Tell us a bit about that in line with what you have planned.
Thank you. I want to tell Kenyans that we have the big one that will be coming up on the 12th of December, which falls on Sunday.
Yes.
The World UHC Day is an international event that is marked across the world since 2018, when the United Nations, through a unanimous resolution, gazetted that particular day to be the World UHC Day. It's a very important day in which we remind, leaders are reminded that healthcare is a priority. And it requires that all leaders affirm that they will provide affordable, accessible, sustainable, quality healthcare to all persons in the world. Now, the theme for this year's World UHC Day is leave
no one's health behind.
Yes, leave no one's health behind. Invest in health systems. The underlying reason behind it is that we've come from an area of challenge and controversy. We've had the COVID pandemic, and this December marks 2 years since COVID cases were first reported in Wuhan, China. The pandemic is still here, and for us to be able to beat it, we need to invest in resilient healthcare systems. I'm calling upon Kenyans to come up in numbers, support the World UHC Day as we strive to get rid of this virus that is still here.
Absolutely.
Especially now we have the Omicron variant that is spreading rapidly across the world. At NHIF, we've planned a number of events. If you can check our social media handles, we're already sending out messages to inform Kenyans on the UHC journey. We intend to have an event which is currently being planned and which we'll be able to share to the members of the public, whereby we will be able to showcase the progress made towards 100% attainment of universal health coverage.
Okay.
Yeah.
And we do hope to actually see it. You know, Kenya tunapenda kuona. We like to see it. Tuambie ndio hii hapa. But of course, all that will be coming up this Sunday as we are part of the global population when it comes to ensuring universal health coverage for each and every individual. It is part of the Big Four agenda. By 2030, we shouldn't be talking of people not being able to have access to affordable healthcare services here in our country. And we have been speaking with Gilbert Osoro, who is the manager in charge of UHC Universal Health Coverage under NHIF. Thank you very much, sir, for being with us today.
Thank you. I'd like to conclude by saying that it is true health that is true wealth.
Health is wealth.
Yes.
There you have it. Thank you so much once again. We hope to have more of these conversations as we always do here on Good Morning Kenya. But for now, we want to wish you a lovely day. Thank you so much for your time. I am Jain Wambui. Do enjoy the rest of your viewing.